Good morning. Hi, Sophie. This is Glenda.
Good morning.
Sophie has had her procedure and is recovering on the ward. Our nursing colleagues Glenda and Carlos are preparing for handover. Handover is where the care of a patient transfers from one member of staff to another. We currently document our patient's care in a paper nursing booklet. This video demonstrates how using our new Cerner EPR will enable our nurses to electronically document patient care, making information more accessible, meaning no more hunting around the ward for patient notes. Here you will see Carlos using our handover page. The page has been created to support a consistent handover with real-time documentation at the patient's bedside, improving communication. Carlos has completed his patient handover and heads back to his ward. Glenda now starts the nursing admission documentation on our Cerner EPR. When a patient arrives on the ward, the nurse will automatically be tasked with 3 assessments. These assessments have been carefully designed with colleagues to capture the current assessments that are presently recorded within the paper nursing booklets. Glenda navigates to Care Compass on PowerChart. This is the landing page and is a dashboard for patient care tasks, upcoming, due and overdue. Here, the nurse is able to see information such as location, plans of care and early warning score. Glenda starts to document her 3 admission assessments. Any information that had been documented by the theatre recovery team will automatically populate for Glenda to review and add further detail if necessary. Discharge planning starts on admission, and our new Cerner EPR will automatically suggest the discharge care plan for all patients admitted to the hospital. Glenda can now start to document any information which will support Sophie's discharge, for example, who she lives with and how she will get home on the day of discharge. Glenda starts to complete Sophie's pain care plan. Care plans are used to support standardised treatment of a diagnosis, problem or condition, which are made up of patient-focused goals and outcomes, interventions to help support the care, and reference text which highlights best practice. The care plan supports Sophie's care by prompting and making reference to other support available, such as specialist team support. Care plans do not remove the nurse's clinical decisions, but they assist them. They make communication clear, as all care provided will be documented, and this enables nurses, therapists and doctors to view the steps of the care plan and the care provided. Sophie's being interviewed by Mr. Durrant. The doctor in training adds Sophie to their patient list and opens her electronic patient record. The landing page for doctors is the Message Centre. The Message Centre is an internal communication system where results can be endorsed and direct consultation requests will sit. The landing page can also be configured to the doctor's worklist view. This shows a list of all patients under the consultant's care or the ward they are visiting. At Sophie's bedside, the doctor in training navigates to the documents area to review clinical notes from the previous shift. After this, they navigate to see the most recent bloods on the Results and Review tab, and then to Assessments to review the latest observations. This is all performed at the patient's bedside, enabling our clinicians to spend maximum time with their patients. Sophie's progress is reviewed, and Mr. Durrant has a conversation with her to ensure that her discharge plan is personalised and tailored to her individual needs. This results in Sophie receiving confirmation that she is medically fit for discharge and is ready to go home. Mr. Durrant navigates to the Discharge M page on PowerChart. This automatically populates the relevant components based on the information captured by the multidisciplinary team throughout Sophie's stay. This means the process of creating the electronic discharge summary is quicker, as the clinician can review pre-populated information and electronically prescribe any TTO meds.